Welcome back to the Arizona Daily Mix. This is the time that we talk with Dr. Rizik about heart disease, taking care of yourself. We have a procedure coming up here soon. Our last one was successful. So of all your procedures, that's all. We're sitting here relaxed. We're talking a little bit. Last week we talked about, of course, women and heart attacks and heart disease. Today we're going to talk about how to prevent them, how to, of course, address them in the clinic and what you guys do.
You know, we can discuss women having heart attacks, but I always like to talk about prevention. We see a lot of young women, or women of all ages, come into our clinic, and the most important thing we can do to treat heart attacks is to prevent them. We discussed last week that women present later with symptoms. You know, when women come into the office, you have to be very, very, very vigilant and ask very probing questions with respect to their symptoms. Because as we talked about, even anginal symptoms, chest pain symptoms that men may experience, women don't. Yeah. Women have dizziness, they may have shortness of breath. The symptoms, it can be the same, but it can also be very different, more often different than the symptoms men have. And when you develop a diagnostic strategy for women, you have to remember many of our diagnostic tests, even in the outpatient clinic, not as predictive, not as sensitive at diagnosing heart disease in women as in men.
Yeah. Something that's very important that we need to make sure that people understand, and that is heart attacks in both men and women, but especially women, does not look at weight, does not look at gender, look at age. It looks at the stress, it looks at the way they are eating, doing different things. And that's one thing you talk about, we were saying before coming on, even with me, but also is that it's about exercising. It's about making sure you're doing the right things there to prevent.
It's about risk factors. You're 100% right, Brad. It's all about risk factors. So in preparation for today, I was looking at some studies, and I found an Australian study that's very interesting. Did you know that in young women, 35 years of age, 90% of women have at least one risk factor for heart disease, and 50% of women have at least 3 risk factors for heart disease. So when a woman presents to her cardiology office, or to her internal medicine office, or to her GYN, we can, at a very early age, begin to look at these risk factors and modify risk. And as you and I have talked about many times, it's not just about what you do, it's about what you don't do. Many people become sedentary at a very young age, not exercising. Reducing fat intake, cessation of smoking, drop your weight so that diabetes doesn't become one of those risk factors. So it's about what you do, but also about what you're not doing in terms of modifying risk.
So modifying the diet, modifying the different areas. When you do have someone who is coming up with heart disease, what's some of the things that you talk with them to help them so they don't have to come see you in a surgery so much?
Yeah, we can't change someone's genetic predisposition. So that's a discussion that we don't spend a lot of time on. But the minute a woman is a diabetic, or the minute any patient is a diabetic, intensive management of their diabetes, and then automatically intensive lowering of their cholesterol. If you're a diabetic, chances are your cholesterol isn't where it should be, and so we tie those two things together. We really strive to get them into a formal exercise program, and of course, drop weight. Most of us are over our ideal body weight. In fact, the biggest malnutritional problem in America is not starvation, but being overweight. So really tying all of those things together at a very early stage in our diagnostic and therapeutic strategy.
Yeah, it's also, I will say, men, you need to pay attention to your spouse or girlfriend's symptoms yourself. If they do say, oh, I'm feeling a little dizzy, or I got short of breath just, walking from the kitchen to here, I've been doing too much. We need to say something, you know what, sweetie? we need to go sit and talk with somebody.
Because when a woman presents with heart disease, when a woman presents with a heart attack, it's interesting, their prognosis, even with our modern therapies, is not as good as a prognosis of a man having a heart attack. So you're right, paying attention to the symptoms that our girlfriend or our wife may express. And the symptoms can be very subtle and they can be very different. I love the way you've couched this. These are very important things for us to pay attention to.
Yeah, very important. So that's why I always like having you here. That's why I like that the procedure that we're going to be coming up with is going to be another important one. And I think this one I might understand more because this is putting in, are we doing a stent this time?
What we're going to do is take you and the audience from beginning to end of what happens when we have a patient come into the hospital with coronary disease. What are the steps we take leading up to cardiac catheterization and a stent procedure, and also how we implant that stent so that those patients reduce the risk of ever coming back again. And what are the things we do on discharge to help reduce the risk of them coming back to the hospital again.
There it is. Thank
It's
doctor.
not just about the stent procedure, but it's everything surrounding that procedure.
See, there you go. That's why you tune into us, and that's why you need to go to aztv.com/theprocedure on our website to see what we did with the last one and then what is coming up. So, doctor, thanks for joining me again this week.
It's always a delight to be here.
All right.